Hello students, we will discuss a case which is quite common, rather important as far as your exam is considered also. Otherwise also in a surgical OP or onco OP, wherever it is. So what this condition is, see look at this, there is a swelling, there is a earlobe rise, and look at that large swelling in the right upper part of the neck. There is a skin changes, there is a swelling, one other swelling which is about to rupture, looks like that. So what this swelling is, naturally this must be something related to the malignancy. So what are the possibilities? Just see. So mostly this is secondaries in the neck. So first thing comes to your mind is secondaries in the neck. So there are three conditions you have to remember as far as neck lymph nodes are concerned. Secondaries in the neck, lymphoma, maybe NHL or HL, Hodgkin lymphoma, or tuberculosis. So the three prime conditions you have to remember when the neck lymph nodes are enlarged. Now such a localized lymph node, so large, somewhere it is about to fungate, first thing you will think is secondaries in the neck. So that is how exactly it comes. So what is seen in the same patient, you look at this, look at this. When protruding the tongue is deviated towards the same side. So what is this? So this is right hypoglossal nerve palsy. So in hypoglossal nerve palsy, large neck secondaries, once it is fixed to the deeper plane, it will infiltrate the hypoglossal nerve, same sides, ipsilateral side, wasting of the tongue will be there. While protruding the tongue deviate towards the same side, not to the opposite side. Remember, same side. This is the most thing you have to remember. Second thing you have to look for is spinal accessory nerve. That also may get involved. So tugging of the shoulder will be defective. Go behind the patient, ask the patient to sit in a stool, apply pressure over the shoulder, and ask the patient shrug. So this shrugging will be defective. This side, if this is side, this side will bend like this. And if you inspect carefully bare shoulder area, there will be wasting of the trapezius. So wasting of the trapezius muscle, defective shrugging of the shoulder, tongue deviates to the same side. Sometimes Horner syndrome can occur if it infiltrates further deep, involving the sympathetic chain, cervical sympathetic chain. And sometimes it encases the carotid vessel, so may not be able to feel the superficial temporal artery pulsation. So all these things has to be looked for. Now where may be the primary, maybe parotid, or maybe in the pharyngeal axis, maybe in the oral cavity, that you have to look for. Primary is the most important thing. So what other special things to look for? Already told, involvement of spinal accessory nerve, cervical sympathetic chain, carotid artery encasement, opposite side. Look for primary. That's the thing you have to remember always. FNAC conclusive, always lymph nodes. You will not do biopsy unless you think it is Hodgkin lymphoma or tuberculosis. FNAC is the initial investigation. Second is open biopsy is not done. Only identify primary and do the open biopsy as the primary. And if it is lymphoma, open lymph node biopsy is a must to mark and find out the further histological details of the lymphoma, either Hodgkin lymphoma type or non-Hodgkin lymphoma type. So pan endoscopy is very important. CSCT neck is essential. Chest, abdomen, all three areas. And treatment of course, this is a very advanced treatment is palliative chemotherapy. With RT, little tricky, that will be decided by the oncologist, but here treatment is palliative, no role of surgery in this patient as far as now is considered. There's a point you have to remember, the common short case in the kept in the exam, oxy also will ask, theory also they may ask. So differential diagnosis also you have to remember lymphoma and tuberculosis. So answer the MCQ, structure preserved in radical neck dissection is vagus nerve, sternocleidomastoid muscle, submental salivary gland, internal jugular vein. So students, put the answer in the comment box. I will give the answer, or tomorrow. So go through this and put in the comment box, please. So please go through my clinical method in surgery for examination of neck in detail with the video. My manual of surgery gives the details about the radical neck dissection and other methods, other neck swellings also. And operative surgery shows the technical aspect. And my video lectures, the DigiNerve, always covers everything about UG, CBM syllabus A to Z, including specialty, operative surgery, X-ray specimen and images. So students, I hope you have understood this topic very well. Thank you very much.